So a big question that I get asked, and again, this is another good question, is Sharon, am I a good candidate? How long will this last? I will say that the data shows significant improvement for the vast majority of what we call mild to moderate erectile dysfunction. And let me just break that down because it's important to understand that not everybody will benefit. That does not mean that I would not be willing to help those that fall into the may not benefit category, especially if you have nothing else that's left as an option. I'm certainly willing to help to the extent that I can. But let's talk about the qualified candidates. So generally speaking, qualified candidates fall into the mild to moderate category when you complete the International Index for Erectile Function. There's a scoring platform, and part of that scoring platform basically allows the physical therapist or healthcare provider to understand the severity of what's going on. But the physical exam is also part of that. Most people, and that's why I'm going to focus more on the people that can't or should not qualify, fall into the category of mild to moderate, unless there's been severe trauma or there's been a prostatectomy or some type of procedure to the prostate that involves chemo and radiation, and we'll talk about that in a separate video. But for those that really have a greater struggle with improvement are the three following, and that is not in particular order, but people with diabetes, that's a big one, people who smoke, and men that are overweight. Those three categories can be a big challenge in terms of erectile dysfunction because you have to understand why the erectile dysfunction started in the first place. That'll be a different video, and we'll talk about that in another video. What leads to erectile dysfunction? What are the causes of erectile dysfunction? Also, what are the treatment strategies that you can use? It's not just about shockwave therapy. We also do pelvic floor strengthening and other exercises to help promote circulation in the area, as well as the strength of what we call the pelvic floor muscles. And I'm just going to briefly show you the demonstration of the male pelvic floor. Obviously, the most obvious is our penis, but what you don't see is what's happening underneath here in terms of the pelvic floor, the bladder. Underneath, we've got musculature that are part of the pelvic floor as well. So I hope that helps. I know that's a long explanation, but generally speaking, the vast majority of men who are suffering from erectile dysfunction can see improvement. Does not mean that those people with diabetes who are smokers and drinkers or are overweight can't benefit. It just may be more challenging and it might take several more visits. Those are things that we would talk about in the examination. Hope that helps.